Have you been told you need to have spine surgery? But not to worry, it's minimally invasive. Do you really know what that means? You should know, because that could mean the difference between a quick recovery versus a long one, or maybe even the outcome. This is Dr. Abani Chowdhury with Arizona Neurosurgery and Spine to help us better understand what minimally invasive really means. So good to have you with us. I understand you help people with conditions with the brain and the nerves. When should someone seek out a neurosurgeon?
When they start getting pain in their neck or their legs, and that pain is affecting the quality of their life such that they can't do things that they enjoy doing.
Right, and then we're talking golf, we're talking running, picking up your grandchildren or your children.
Exactly.
And that's tough. Okay, so today, Dr. Chowdhury is here to educate us on the advancements in minimally invasive spine procedures. Can you give us an example of what that looks like today?
Sure. So one of the ways that we've made spine surgery safer and faster and recovery faster is we have these tubes that allow us to make small incisions in the back, and we can operate through the tube and do all the surgery that we need to do. Tube comes out, you get a small little incision.
So put that tube up, that's really small.
Yeah, so it makes it really nice because you can see the spine through the tube, and as a result, you can do a surgery through a very small incision, which means recovery is a lot faster.
Right, we hear this term, especially on this show, minimally invasive, you know, and as a viewer, you're thinking, okay, that sounds like it's good for me. So what should patients be asking their neurosurgeon before getting a procedure like this done?
So I think minimally invasive has many connotations. The main thing that we have to concentrate on is, what can I do? It's the least amount of surgery to get you back to playing with your grandkids, golfing, traveling, without being in constant pain. So that's what minimally invasive surgery should mean, which is this the smallest thing I can have done?
Yeah. And some people, you know, maybe you have a really serious spine condition and you may be wondering, is this kind of minimally invasive procedure right for me? Is there a particular condition that works better with this type of procedure?
Yeah, I think a lot of times people that have herniated disc, people that have arthritis, or the word we use is stenosis, or narrowing around the nerves, they can have this type of procedure to have the least amount of downtime to get back to work or school or wherever they
Do you suggest people come in for that initial consultation, and do you suggest they seek multiple opinions?
I think it's very important to seek multiple opinions. Just like you wouldn't go with the first contractor you hire for a remodel, you want to hear from a few people that you need to have something done. And then two, what's the least amount of surgery I can have done to be functional? All
right, so this is my favorite question. How soon can someone expect to get back to their regular activities?
Yeah, the fastest you can get back is usually within a couple of days to a few weeks. And especially now as we do disc replacements instead of fusions, you can get back to playing pickleball, golf, travel within a couple of weeks of surgery.
When I was chatting with you before the show, you said days, and I said days? Because when you're talking about a big, you know, spine surgery, you're down for months in some cases.
That used to be the case. You know, you used to be on bed rest. Now, motion, motion, motion. We want you moving as soon as possible.
And why should we come to see you?
Well, I think the main reason is I'm going to really think about what's going to make you better, what's the right surgery for you. And I think a lot of times people say, what is minimally invasive surgery, or surgery is my last resort. Surgery should not be your last resort, it should be the right resort.
I love that answer. Thank you so much. We appreciate you. Arizona Neurosurgery and Spine. They are located at 3420 South Mercy Road, Unit 211 in Gilbert. You can give them a call. They also have another location in Sun City. Let's give you that number, 866-974-2673. You can also visit the website, azneurosurgery.com.